Welcome to the Healthcare Personnel Safety Component training session for long-term care facilities. Today, we will review the influenza vaccination summary and the healthcare personnel vaccination module. My name is Elizabeth Kawile, and I work in the NHSN vaccination unit. I'll be presenting information during this webinar, along with my colleague, Amanda Clemens, who is also a member of the unit. So this presentation will cover several topics. The steps on how to get started in the healthcare personnel safety component will be reviewed, along with the surveillance and reporting requirements for the module, and the data reporting forms that facilities will need to use. The last segment of the presentation will outline data analysis features of the module. Also, please note that the slides will be posted to the NHSN website in the coming weeks. There will also be a replay of the presentation on October the 19th at 1 p.m. Eastern Time. First, we'll briefly cover some background information on NHSN. NHSN is divided into 7 components: patient safety, long-term care facility, outpatient dialysis, healthcare personnel safety, biovigilance, outpatient procedure, and neonatal. Each component can have multiple modules. This training is focusing on the healthcare personnel safety component. There are 2 modules within the healthcare personnel safety component: the healthcare personnel exposure module and the healthcare personnel vaccination module. Staff members in healthcare facilities can use the influenza vaccination summary to monitor influenza vaccination percentages among healthcare personnel. The summary level reporting replaces individual level reporting of vaccination status for healthcare personnel, which was previously available through NHSN. So let's take a moment to cover reporting requirements for long-term care facilities. To report annual healthcare personnel influenza vaccination summary data, long-term care facilities will need to report these data through the healthcare personnel safety component. Facilities have the option to report weekly influenza vaccination data through the long-term care facility component at this time. However, this does not fulfill CMS requirements. Long-term care facilities are also reporting weekly COVID-19 vaccination summary data, and facilities should continue to report these data through the long-term care facility component. Now we'll go over some basic elements of the healthcare personnel influenza vaccination summary. The healthcare personnel vaccination module is designed to ensure that healthcare personnel influenza vaccination reported coverage is both consistent over time within a single healthcare facility and comparable across facilities. Using NHSN reporting requirements to monitor influenza vaccination among healthcare personnel may also result in increased influenza vaccination uptake among healthcare personnel, because improvements in tracking and reporting influenza vaccination status will allow healthcare institutions to better identify and target unvaccinated healthcare personnel. Increased influenza vaccination coverage among healthcare personnel is expected to result in reduced morbidity and mortality related to influenza virus infection. This slide presents an overview of data collection. Data are collected on denominator and numerator categories. For the denominator, healthcare personnel must be physically present in the facility for at least 1 working day between October 1st through March 31st. This includes both full-time and part-time healthcare personnel, which are employees, non-employee licensed independent practitioners, and adult students, trainees, and volunteers. Numerator data are collected on influenza vaccination, medical contraindications, declinations, and unknown status. Facilities are required to report all numerator categories for the 3 denominator categories. The next slides provide an overview on how to get started in the healthcare personnel vaccination module. Now we'll talk about how to use the healthcare personnel safety component. First, we'll go over some key roles in NHSN. The NHSN facility administrator is the person enrolling the facility in NHSN, is the only person who can activate additional components for the facility, has add, edit, and delete rights to facility data, users, and users access, has the authority to nominate and join groups for data sharing, and is the only person who can reassign the role of facility administrator to another user. There can only be one NHSN facility administrator per facility. Users have the ability to view, enter, and analyze data, but these rights are determined by the facility administrator. Users may also be given administrative rights. It is recommended that each facility have at least 2 NHSN users. One of these users should have NHSN facility administrator rights. We'll now briefly talk about activating the healthcare personnel safety component. Please note that this component only needs to be activated one time. Only the NHSN facility administrator can activate a new component. During this process, the NHSN facility administrator will add the healthcare personnel safety component primary contact as a user within the facility. It's important to keep the contact information for both the facility administrator and the primary contact updated, especially when there is staff turnover, so that the correct individuals can be reached if NHSN has updates or questions about the component data. The NHSN facility administrator can then add the primary contact as a user within the facility. To do so, the administrator should click on Users on the navigation bar and then click on Add. Next, the administrator should complete the mandatory fields for the Add User screen. This consists of the user ID, first name, last name, and email address. Other users can be added by the NHSN facility administrator or the new healthcare personnel safety component primary contact. Users with administrative rights will be able to add additional healthcare personnel safety component users and share data using the group function for the component. This slide covers some key points on what facilities can do if there is a change in facility administrator. The NHSN facility administrator should transfer the role to another user prior to leaving the facility. However, if this does not occur, NHSN can add an individual as the new facility administrator if the previous administrator has left. In these cases, please do not re-enroll the facility in NHSN. Instead, please complete the NHSN facility administrator change request form linked on this slide. After being assigned as the new administrator, the individual can then begin the new NHSN user onboarding process. Now let's review the specific reporting requirements for the healthcare personnel influenza vaccination summary. The healthcare personnel influenza vaccination summary protocol provides guidance for a facility to collect and report influenza vaccination summary data for the healthcare personnel vaccination module. It includes comprehensive information about reporting requirements and specifications, such as numerator and denominator categories, methodology, data analyses, and key terms. Each facility should thoroughly review the protocol before collecting and entering data into NHSN. As we noted previously, there are 3 required denominator categories. One category consists of employees, while the other 2 categories consist of non-employees. One non-employee category is licensed independent practitioners, and the other category includes adult students, trainees, and volunteers. To be included in the denominator, all healthcare personnel must be physically present in the facility for at least 1 working day during the reporting period, which is between October 1st through March 31st. Please note that working any part of the day counts as working for 1 day. So for example, working for 2 hours during the day counts as working for 1 day. This slide shows the top portion of the healthcare personnel vaccination summary form, which lists the denominator categories. Employees are defined as all persons receiving a direct paycheck from the healthcare facility, regardless of clinical responsibility or patient contact. The second denominator category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants, who are affiliated with the healthcare facility, but are not on the facility's payroll, regardless of clinical responsibility or patient contact. This category also includes post-residency fellows. The third required denominator category consists of non-employee adult students, trainees, and volunteers aged 18 and over. This is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older who are affiliated with the facility but are not on the payroll. And again, this is regardless of clinical responsibility or patient contact. The fourth denominator category consists of non-employee contract personnel. Reporting for this category is optional at this time. Contract personnel are defined as persons providing care, treatment, or services at the facility through a contract and who do not fall into any of the other denominator categories. Some examples include dialysis technicians, occupational therapists, admitting staff, and pharmacists. Please refer to Appendix A of the Healthcare Personnel Influenza Vaccination Summary Protocol for a suggested list of contract personnel. If a facility decides to report contractor data, it can note which categories of personnel are included in their data by using the comments function in NHSN, which will be noted later in the presentation. Vendors are also included in the other contract personnel category, regardless of clinical responsibility or patient contact. Therefore, vendors providing care, treatment, or services should be included in this category if they physically work in the facility for at least 1 day during the reporting period. The numerator includes healthcare personnel who received an influenza vaccination during the time from when the vaccine became available through March 31st of the following year. There are 5 numerator fields in the NHSN module. This slide highlights the numerator categories as they appear on the Healthcare Personnel Influenza Vaccination Summary form. The categories include influenza vaccination received at the healthcare facility or elsewhere, medical contraindications, declinations, and unknown vaccination status. The first numerator category is healthcare personnel who received an influenza vaccination either at this healthcare facility or elsewhere. Please note that these are 2 separate fields in the NHSN module. The first field includes healthcare personnel who received an influenza vaccination at the healthcare facility since the vaccine became available for the season. The second field includes healthcare personnel who were vaccinated outside the facility since vaccine became available for the season, and provided a written report or documentation of vaccination. Acceptable forms of documentation include a signed statement or form, an electronic form or email from the healthcare worker, or a note, receipt, or vaccination card from the outside vaccinating entity. Please note that verbal statements are not acceptable for the module. The second numerator category is healthcare personnel who have a medical contraindication to the influenza vaccine. For this measure, for inactivated influenza vaccine, accepted contraindications include a severe allergic reaction after a previous vaccine dose or to a vaccine component, including egg protein, or a history of GBS within 6 weeks after a previous influenza vaccination. Healthcare personnel who have a medical contraindication to live attenuated influenza vaccine, other than a severe allergic reaction to a vaccine component or a history of GBS within 6 weeks after a previous influenza vaccination, should be offered inactivated influenza vaccine by their facility if that's available. Therefore, the medical contraindications stated above are the only accepted contraindications for the module. Documentation is not required for reporting a medical contraindication, and verbal statements are acceptable. The third numerator category is healthcare personnel who were offered and declined to receive the influenza vaccine. Documentation is not required for reporting declinations. The fourth numerator category is healthcare personnel with unknown vaccination status, or they did not meet any of the criteria for the other numerator categories. This slide reviews a few points about reporting requirements. Facilities are only required to report data once at the conclusion of the reporting period. Healthcare personnel who are physically present in the facility for at least one working day during the reporting period are included in the denominator. Therefore, healthcare personnel always working off-site or out of state should not be counted since they are not physically working in the facility. Healthcare personnel in the denominator population who received an influenza vaccination during the time from when the vaccine became available, such as August or September, through March 31st of the following year, are included in that category numerator, since vaccine for a given season may be available as early as August or September. Please note that the denominator categories are mutually exclusive. The numerator data are to be reported separately for each of the denominator categories. It's also important to recognize that the numerator data are mutually exclusive. The sum of the numerator categories should be equal to the denominator for each healthcare personnel group. We will now go over entering data for the healthcare personnel influenza vaccination summary. I will turn the presentation over to my colleague, Amanda Clemens.
Thank you, Elizabeth. We will now review the reporting forms. After a facility has enrolled in NHSN and/or has activated the healthcare personnel safety component and added users, staff members at each facility must complete the required healthcare personnel influenza vaccination summary form. The seasonal survey on influenza vaccination programs is an optional form, so it is not required. The survey aims to gather information on influenza vaccination programs for healthcare personnel by collecting data on types of personnel groups that are included in a facility's annual influenza vaccination campaign. Methods a facility is using to deliver influenza vaccine to its healthcare personnel, and strategies a facility uses to promote and enhance healthcare personnel influenza vaccination. To begin entering data, users will first need to log into NHSN through SAMS. Please note that Level 3 SAMS access is needed to enter data into the healthcare personnel safety component. If you have questions or need assistance with using SAMS, please contact the SAMS help desk by phone or by email using the information listed on this slide. This slide shows the NHSN landing page. Select the appropriate component, which is healthcare personnel safety, and facility from the drop-down boxes. Next, click the Submit button to proceed. This slide shows the healthcare personnel safety component homepage. You will see that there's a navigation bar on the left-hand side of the web page, which can be used to access different parts of the module. Please note that the monthly reporting plan will no longer be required to complete prior to reporting annual healthcare personnel influenza vaccination data beginning with the 2022-2023 influenza season. Upon saving or uploading data, users will agree to the following. The data reported are consistent with definitions outlined in the NHSN surveillance protocols, including tables of instructions and frequently asked questions. The data will be sent to the Centers for Medicare and Medicaid Services, CMS, to fulfill CMS quality reporting requirements when applicable. Each facility will use the healthcare personnel safety, each facility will use each facility will use HCP influenza vaccination summary form to collect summary data. The NHSN module contains a single data entry screen to input summary data for each influenza season. When a user enters data, all previously entered data for that season will be overwritten. A modified date will be auto-filled by the system. Therefore, a facility would like to keep track of its monthly numbers, it should maintain its own record of this, as it will not be able to review monthly reporting numbers in NHSN. CDC and NHSN encourages that healthcare personnel influenza vaccination summary counts be updated on a monthly basis. However, as mentioned earlier, entering a single influenza vaccination summary report at the conclusion of the measure reporting period will meet the minimum data requirements for NHSN participation.
Thank you, much better.
Yes, okay, thank you. The table of instructions for the influenza vaccination summary provides instructions and complete definitions for each data field for the denominator and numerator categories in the module. This document is located within the influenza vaccination summary protocol. This slide highlights the employee category. The user can see the definition of an employee in the right-hand column. This slide shows the steps facilities can take to access the healthcare personnel influenza vaccination summary form. First, click on Vaccination Summary, then Annual Vaccination Flu Summary on your navigation bar. Select Add, next click Continue to view the data collection form. This is what facilities can see on their screen in NHSN when adding influenza vaccination summary data. You must complete all fields marked with an asterisk on this page. Influenza and seasonal are the default choices for vaccination type and influenza subtype. The user can select the appropriate flu season in the drop-down box. For example, if you are reporting data for the 2022-2023 influenza season, you must select 2022-2023 in the drop-down box. Facilities can always contact NHSN if they are unsure of which influenza season is currently being reported. This slide shows what the data entry screen looks like in the NHSN module. Question 1 pertains to the denominator, and question 2 through 6 pertain to the numerator. The asterisks on the screen indicate the columns that must be completed. Users can use the Tab key on a computer keyboard to move across the columns. Users should enter 0 in a field if no healthcare personnel at the facility fall into that category. The comments box can be used to enter additional information, which are usually side notes or reminders. However, the information cannot be analyzed within NHSN. As a reminder, please note that the summary record must be entered into NHSN by May 15th. Only data entered into the healthcare personnel safety component will be submitted to CMS. Therefore, Any weekly influenza vaccination data entered into the long-term care facility component will not be submitted, as the CMS requirement pertains only to annual influenza vaccination summary data. Once you have completed data entry, save the data by clicking the Save button at the bottom of the screen. For each update of the influenza vaccination summary data after the initial entry, you will see a message at the top of the screen indicating that a record of the summary data already exists. The date last modified shows when data were last entered and saved. If you would like to edit or update your facility data, simply click the Edit at the bottom of the screen for modifying existing data. Please be sure to save any changes by clicking the Save button at the bottom of the screen. We will now go over the data analysis features for the healthcare personnel influenza vaccination summary. To view data, go to Generate Datasets under Analysis on the navigation bar. Click Generate Reporting Datasets and select OK when a message appears on your screen that says the current datasets will be updated. Are you sure you want to continue? Users should generate a new dataset each time they enter new data into the system. Next, go to Output Options under Analysis on the navigation bar. You will see several folders on the screen. Facilities should click on the HCW Healthcare Worker Vaccination Module and Influenza to view the default output. Click Run Report. Facilities can view various reports, such as total numbers or summary counts, percentages, vaccination compliance figures, and vaccination non-compliance figures. The user can see the summary counts listed by influenza season and by variable. This example shows that 8 employees worked during the required time period during the 2020-2021 influenza season, while 100 employees worked during the required time period during the 2022-2023 influenza season. 2 overall totals are presented. One number includes the total number of healthcare personnel working without other contract personnel, which is 24 healthcare personnel for the 2020-2021 influenza season. Another number shows the total number of healthcare personnel working with other contract personnel, which is 250 healthcare personnel for the 2022-2023 influenza season. Please note that reporting contract personnel is not currently required. Therefore, it is fine if 0 is entered for the number of contractors, even if there are contractors working in a given facility. This slide shows vaccination compliance percentages, including other contract personnel. Please note that vaccination compliance, including other contract personnel, can also be viewed. The example indicates that 25% of healthcare personnel were vaccinated either at this facility or elsewhere in 2020-2021. Also, 100% of healthcare personnel were vaccinated in 2022-2023. The percentages for vaccination compliance are created by adding the total number of healthcare personnel who were vaccinated on site to the total number of healthcare personnel who are vaccinated elsewhere, excluding other contract personnel. Dividing this number by the total number of healthcare personnel working during the required time period, excluding other contract personnel, and then multiplying this number by 100 to obtain a percentage. For users wishing to modify the default analysis option, the default analysis output, they can click Modify next to the report they wish to modify. The modify function can be used to view several options. The user can export the data set into various analysis softwares, such as Excel and SAS, change the title of a modified output for later use, and change the format of the output so it can be viewed in a PDF or HTML format. This slide shows what a user will see when they click Display Variables to modify the variables to display. A subscreen will appear that lists variables. The arrows can be used to move variables between the 2 columns of available variables and selected variables. The up and down buttons on the right side of the screen are used to change the display order of the variables. Remember to click the Save button when you are finished. A facility also has the option to view output using descriptive variable names. This option can be selected by clicking the box next to Show Descriptive Variable Names on the modification screen of the report. Facilities can visit the NHSN website using the link on this slide. The website contains links to the protocol, data collection forms, frequently asked questions, and training slides for healthcare personnel influenza vaccination summary reporting. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. You should also include HPS flu summary or healthcare personnel safety flu summary in the subject line of the email and specify you are a long-term care facility. This concludes the presentation. Thank you so much for your time.